Welcome to the JRCALC podcast. Join us as we delve into the latest updates and insights from the JRCALC guidelines, your essential resource for paramedic practice. Whether you're on the front lines of emergency care or simply passionate about pre-hospital medicine, this podcast is your go-to for staying informed and up to date. Each episode will break down the newest guidelines, discuss their implications, and hear from experts in the field. So, wherever you may be listening from, whether it be on the road or at home, settle in and let's better understand the world of paramedicine.
Welcome to this podcast where we're going to be talking about the updated adult end-of-life care guidance in JRCALC. My name is Rowena and Rickson and I'm Macmillan Paramedic Associate with the end-of-life care team at London Ambulance Service. I'm here today with Ed and Jen, who've both played a key role in the revision of this guidance.
Hi, I'm Jen Scott-Green. I'm a palliative care paramedic by background, end-of-life care lead for South East Coast Ambulance Service. Ed.
Thanks, Jen. I'm Edward O'Brien. I'm a paramedic and the clinical lead for end-of-life care in Welsh Ambulance Service.
Thank you all for joining this podcast. We're here today to talk about the end-of-life care guidance, as Rose says. It was updated for 2025. So the guidance this year has been created by a whole team of specialists. So we have a National Ambulance Clinical End-of-Life Care Leads Forum, and within that we have clinical nurse specialists from end-of-life care, palliative care paramedics, and of course all of us work within roles within Ambulance Trust. So we're really excited to bring you this 2025 guidance. We're going to talk through some of the key points and some of the changes that have come in this year. And largely, it's an update and it's a refresh from the 2020 guidance. And we found that when we look back at the 2020 guidance, there was a lot of education in there. So what we've tried to do is look back at the 2020 guidance, review it, update it with all the new information that's going on, and take out some of the education side of it and make it more succinct and easy to use when you're in the heat of the moment on scene. And as part of that, we've taken a lot of the evidence from the research that's going on at the moment. So there's lots of reports coming from charities like Marie Curie and Macmillan, the Better End of Life Care Report. There's a Palliative and End of Life Care Commission looking into the care across the UK. So there's a lot of changes going on at the moment. And alongside this, there's a lot of change and improvements going on within Ambulance Trust, specifically around palliative and end of life care. And I think largely a lot of that is around the recognition that palliative end-of-life frailty is a huge proportion of the work that we do within Ambulance Trust. So we need to update and move with the times with our guidance to support this ageing population and a change in our workload. And as part of that is quite a big cultural change around how we approach patients with palliative and end-of-life care in mind. And a lot of that is around holistic, patient-centred care. So, Ed, I wonder if we could just start with having a little think about what holistic patient-centred care actually means.
Yeah, thanks, Jen. So I guess what we're looking at is we're looking more than just the physical symptoms. We want to look at social, psychological, and spiritual needs for each patient. We need to sort of recognise what palliative care is and when it is and when it isn't appropriate. So, of course, palliative care is for people who are living with terminal illness where a cure is no longer possible, and that might be anything from end-stage frailty to dementia to cancers. There's multiple areas within palliative care where a palliative care approach is appropriate. And what palliative care does is it looks at that holistic approach, like you said, Jen, and it makes sure that we're doing what's right for that patient. And of course, also recognizing when delivering end-of-life care is appropriate. So end-of-life care, the definition of that would be a patient with a palliative condition who's considered to be somewhere within their last 12 months of life.
So let's talk a little bit about what's new in the guidance. And there's sort of 4 key areas that we're going to focus on: communication, the SPICT tool, reversible conditions, and palliative care emergencies. So, Jen, should we start with talking a little bit about the communication side of these jobs?
Yeah, thanks, Ray. There's, of course, lots of different models of communication and breaking bad news that are out there. And I think we'll all find a way of breaking bad news and having difficult conversations as we gain more experience as clinicians, and we'll find a model and a tool that that works well for us. In the JRCALC guidance, we've given some suggestions and we've given some top tips that have worked well for us as clinicians. But I think the main reminder is just to be calm, kind, compassionate, and just make sure that we're using plain language and we're not using that jargon to describe some of the medical terminology that people just don't take in when they're really when they're really distressed. So we've just given you some key points that are really beneficial and that we found helpful during our time and experience in palliative and end-of-life care when having these conversations and when breaking bad news. The next key point and the new content that we wanted to talk about is the SPICT tool. And this is something, Ro, that you've been using in London for a little while now.
Yeah, thanks, Jen. Yes, we have. So for those who aren't aware of it or it's new content to you, there is a copy of the SPICT tool now in the new JRCALC guidance. SPICT stands for Supportive and Palliative Care Indicators Tool, which is a bit of a mouthful, but actually it's a lot more straightforward to use than it probably is to say. As you said, we've used it in London for a little while now. It's really key for identifying or helping to identify patients whose health is deteriorating, and maybe entering that last 12 months of life that Ed mentioned at the beginning. And it's really key for starting those advanced and future care planning conversations that we'll speak about a little bit later, and just trying to identify those patients at the appropriate point. And I think as ambulance clinicians, we have a real responsibility for that because we do go into patients' houses and see patients at kind of all points in their life, of course. But we're really uniquely placed to use this tool to identify them at an appropriate time and obviously then communicate those findings to other healthcare professionals, which I think is really key.
Yeah, you're so right, Ro. I think we are in such a privileged position to be in people's homes, and there's not really any other area in the sort of healthcare system where we kind of see patients that are in that crisis from both a healthcare and sometimes a social perspective as well, and using this tool and finding our place in the system as ambulance services and making those pathways of how we refer people on for care planning, for example. I think it's going to be really interesting to see how that evolves over the next few years. I think one of the other really difficult and unique parts of our care that we give in palliative and end-of-life care as ambulance clinicians is looking at reversibility. And that's one of the things that we've tried to highlight in the new JRCALC guidance as well. It's such a difficult decision, isn't it? That trying to decide actually, is someone dying or is this reversible? And it's really hard when we're thinking about things like sepsis and infection and all of these other complex conditions that we see in palliative and end-of-life care. So we've used the guidance just to add in some key pointers to think about when we're in those really difficult situations, like going back to care plans, just thinking and reflecting, could this be the dying phase? Are there any known complexity around sort of specific conditions? So, for example, cancer, could this be a palliative care emergency? And we're going to talk about that a little bit later on as well. But it can be really difficult actually trying to work out if a condition is reversible or not. And like I say, there is now a whole new section as well on palliative care emergencies. So we do talk specifically about sepsis, we talk about hemorrhage, and some of the electrolyte imbalances as well. And there's some quite detailed information in the new guidance. And alongside that new guidance, we're also going to do some webinars, which are going to be very clinically focused in the new year, just on these new sections. So there's going to be a series of 4 different webinars that are going to be more of a deep dive into the guidance and more of the clinical information.
That's great. Thanks so much for sharing that, Jen. Let's talk about some other key areas which might not be new within the guidance, but they have been refreshed with the aim that they're just a little bit more easy to use within a clinical setting. So, Jen, would you mind just talking us through advanced and future care planning?
So we know there's such a wide variety of care plans across the UK, and it's been really difficult to try and distill all of that information down into JRCALC guidance. So what we've done is we've put it into a table, and we've put some very key points that you would need to know at that very emergency point of care when you're with a patient. And we've categorized it into different care plans. So you'll see that treatment escalation plans are on there, which is part of the deciding right process. You'll see respect plans are on there. And there's ADRTs, information about lasting power of attorney as well. So please do go and have a look at that table. Do familiarise yourself with the information that's in there. And we hope that that format's really useful for people. And of course, advanced and future care planning is kind of the key to palliative and end of life care in a way, because it is all about holistic patient focused care. And it's what we can use to help us with our best interest decision making and when we're having conversations with patients and families. But we really hope that this new format and the table is a helpful reminder to people of what's out there and what you could look for in the house and what's useful to find. But we absolutely recognise there's huge variation regionally in care planning. Just in addition to that as well, advanced and future care plans will be something that we talk through in webinars as well. So please do let us know if you've got any specific questions about the guidance and the table. Another, just to stay on the theme of webinars, another webinar that we're going to have is around patient assessment and symptom control as well. So Ed, I just wonder if you could talk us through some of the information that's in there around patient assessment.
Yeah, so the patient assessment section has been reformatted or refreshed. And to me, it's clearer and easier to use. And it focuses more, perhaps, than it previously did on the holistic assessment, which we've already mentioned. So that's your physical, social, psychological, and spiritual needs. And it breaks it down and it gives a really good table of all the areas for ambulance clinicians to consider discussing or asking about with the patient or their care provider. And it's about finding out what's important to the individual, and it's enabling us essentially to provide care that's in line with the patient's wishes wherever possible. And so, of course, when it comes to holistic assessment as well, there's also in the next chapter, which is symptom control, an area on total pain, which covers off these 4 holistic assessment areas. Rowena, I wonder if you could tell us a little bit more about that.
Yeah, thanks, Ed. Of course. I think symptom control is a really big one for us as ambulance clinicians. We quite often get called because there's a crisis and those symptoms need managing. So for this section, again, as Ed mentioned about patient assessment, this section has been reformatted to hopefully make it a little bit more user-friendly in an emergency situation and includes really useful information on pain and total pain, breathlessness, nausea and vomiting, anxiety, agitation and delirium, and respiratory secretions. And in terms of management, they're really clearly divided into pharmacological techniques and non-pharmacological techniques. And it's really important to consider both of those together to make sure that you're using everything you possibly can to support that patient. And as we've said a couple of times, to make sure that you're supporting them holistically and considering all of their symptoms together and all of the things that you can possibly provide to support that patient as a whole person. One of the things that is at your disposal is considering using medications to support that patient. Obviously, this is going to vary hugely depending on your trust, and it's really important that you refer to your local guidance to support any decisions that you make. There's a lot of regional variation within policy, and that's really important to remember. The kind of general overview is to make sure that shared decision making is really strongly recommended, whether that's through contacting a patient specialist team where available or within your own trust, escalating through your clinical advisory teams. It's really important. These are really unfamiliar medications and you're using them in really unfamiliar situations you've possibly never been in before. So it's really important to make use of those escalation pathways as per your trust policies. And the final bit we're going to talk about is recognising dying. And again, this isn't new information, but it's just been refreshed, revitalised, so it's in a slightly easier to use bullet point format. So hopefully it's quick and easy to access. Separated into symptoms you might see in the last months to weeks and the last days to hours to support all of your patient assessment and your clinical decision making on scene. So as we come to the end of this episode of the podcast, shall we summarise with some sort of takeaway points to consider taking forward into practice? Ed, would you like to kick off?
So there's lots of things to take in from the new JRCALC end of life care section, but for me, the holistic approach is a really important one. So it's recognising what's important to that patient, asking that patient what is it they want and what is it that they don't want in relation to their future care. And of course, if that patient's not able to verbalise their wishes, it's making use of any care plans that may be available to you. So it's finding out if there's anything already documented in respect to future care for that patient.
Yeah, that's so vital, isn't it? That's a really, really good point. Thank you. I think for me, it's about shared decision making and how vital that shared decision making is to support you making these decisions for these patients that you've never met before. Lots and lots of patients will have a specialist palliative care team, but even if they don't, contact the GP, contact someone who knows that patient really, really well. Make use of family where possible, where appropriate, to support all those decision making. And Jen, do you have a third one for us?
For me, I'm really excited to see the SPICT tool in this JRCALC update. I think a lot of clinicians talk to me about how they kind of get that gut feeling that someone's deteriorating, they know things are changing for them. But actually now, by having this tool in use, it gives clinicians something to frame those thoughts around, and how we can make a clinical assessment and make onward referral to get those patients and their carers more support in the future. And I think the future is looking really exciting for us as ambulance services in terms of palliative and end-of-life care. The NHS is changing, the system and the charities that we work with are changing as well. And there's lots of exciting projects going on with our clinical forum, nationally and locally. And we're excited to update you all with some of those changes over the coming months and years. We also look forward to welcoming you to the webinars in the new year, where we'll look at some of these principles and we'll look at the guidance in more clinical detail, and everyone will have the opportunity to ask questions to the specialists around the guidance and any specific questions or points that you want to ask. So please do look out for the adverts for the webinars and get in touch with us if you have any questions in advance. So thank you so much for joining us on this podcast. There's also a podcast around the new paediatric palliative care guidance, and we look forward to seeing you in the new year at the upcoming webinars. Thank you.
Thank you for tuning in to the JRCALC podcast. We hope you found today's discussion insightful and it will be helpful in your practice. Your feedback is invaluable to us, so please take a moment to rate and review today's conversation. You can contact us at jrcalc@aace.org.uk to share your thoughts and let us know what topics you'd like us to cover in future episodes. Feedback can also be submitted through the Parapass app. We'll catch you next time for more guideline insights. Thank you again for tuning in to the JRCALC podcast.